Good morning and happy Friday, everybody. Welcome to our science lesson for today. We're continuing our unit on healthy living, and today we're going to discuss various health routines, going to the doctor and going to the dentist, what it looks like, what we can expect, what kind of tools both community helpers use. So first and foremost, what is a health routine? A health routine describes the things we do on a scheduled basis. It's usually once a year or once every 6 months to make sure our bodies are healthy and free of illness and disease. Some health routines include visiting the doctor for a checkup or wellness exam, going to the dentist for a teeth cleaning or dental exam, and also visiting the hospital when we feel sick or hurt. This I wouldn't really consider a routine so much as an as-needed basis, but I wanted to discuss going to the hospital when you feel sick or hurt as part of our discussion of health routines, just so you know what to expect when you're really sick and you need urgent or emergency care, okay? Because normally when we do a health routine, we're actually in decent health or we don't know that we're sick. We go to a doctor just to make sure that our bodies are functioning, the same with a dentist, that our mouth is clean. And sometimes they find abnormalities during our health routines, okay? So that's perfectly normal. Our bodies fluctuate, especially when you're a teenager. But I also wanted to review what happens in the event of an emergency or if you really need care in an immediate or urgent basis. So going to the doctor. We see a doctor at least once a year for our annual checkup to make sure our bodies are functioning properly. So a few things a doctor may do during that annual checkup rather, include checking our vital signs. So they're going to check your blood pressure using a blood pressure cuff. When they take your blood pressure, they'll also determine your heart rate. The doctor will also check your lung capacity using a stethoscope to make sure that your lungs are clear and that you are able to breathe in and out deeply with no restrictions. Sometimes doctors will administer shots or vaccinations if we are due during that annual checkup. A doctor may also draw blood to check our body's internal functioning. So during a wellness checkup or an annual checkup, they can see us on the outside, but they also may need some more information on how we're doing internally. And so when we get our blood drawn, that tells doctors what our metabolic panels are, what our white blood cell counts are, just various but important aspects of your internal health. And sometimes if they find abnormalities or if they think that you need specialized care, they're going to refer you to other doctors as needed. These doctors are called specialists, and depending upon the area in which the doctor thinks you need more assistance or more clarification, they might send you to a cardiologist, someone who specializes in the heart. They might send you to a gastroenterologist, someone who specializes in the stomach and intestines. They might send you to a pulmonologist. Pulmonologist is someone who specializes in the lungs. So there are all types of different doctors, but when we go for our annual checkup, we're pretty much going to see our family physician or your primary physician. So here's some of the tools that a doctor may use. In the top left corner, we have a stethoscope, which is used to hear our lung sounds and our heart rate sounds. Below it is a tool that is used to see into our ear and into our eyes. It's lighted and provides magnification so the doctor can see if there's any issues with your eardrums or perhaps with your eye functioning. Beside that, there is a tool that is used to check your reflexes. And so the doctor may use this on your knees to make sure that you are demonstrating a proper reflex when that area is hit. The doctors will also check your weight to make sure that you are within a good BMI, body mass index, for your age and height level. On the bottom right here, we have a syringe, which is typically used for shots. So your doctor may apply a shot. They'll clean the area first, of course, and then they will administer the shot, typically in your upper arm. And then, of course, top right is a blood pressure machine. It tells you your systolic over diastolic, and then it also tells you your heart rate. These are important indicators of heart functioning to make sure that you do not have high blood pressure or abnormal readings for your age. All right, going to the dentist. This one is probably less fun for most kids, and I get it. But let's talk about why it's important to go to the dentist. We go to the dentist annually, at least once a year, for a dental exam and dental cleaning. Some things a dentist may do include cleaning our teeth using a variety of often loud and sometimes uncomfortable tools. When this happens, please know that this is okay because a clean mouth means a healthy you. We really want to emphasize our dental health because it's actually tied to our overall health in so many intricate and complex ways. A dentist will check your mouth for cavities and seal them if they find any. They'll take dental x-rays to see what our teeth and gums look like on the inside. And if they need, they'll refer us to a specialist, such as an orthodontist if we need braces. Braces, of course, help to realign our teeth so that they are straight and that they don't give us problems down the road. So if you have braces or need braces, it's important to get them. So here are a few tools that you might recognize from doctor's visits. I didn't want to put too many because they are pretty intimidating to look at, but just know that they're all meant to help clean your teeth, okay? So you'll probably encounter, of course, a toothbrush. They're going to show you the proper way to brush your teeth. They might use this little mirror tool to see behind your teeth and in hard to reach areas. There is a dental scraper that will help remove plaque and tartar from your teeth. And they use a variety of electric tools. All right. Down here, there's drills. There are water tools to help clean your mouth. There's also suction tools to remove your spit or any water that accumulates so that you're not swallowing it during your dental procedure. And of course, there's floss, and then there's some goggles that both you and the dentist may use just to keep your eyes safe since there's a lot of stuff going on during a dental exam. All right, last topic is going to the hospital for urgent or emergency care. So sometimes when we are feeling unwell, such as when we have a high temperature, also known as a fever, or when we are vomiting, so our body's trying to get rid of something. You might also have diarrhea in this case because that's your body's way of trying to remove a substance or something unhealthy to you. Or when we hurt ourselves badly, it is expected that we will go to the hospital for urgent or emergency care. So in these instances below, it is okay to call 911. So if someone becomes unconscious, that means they fall asleep basically. They lose their ability to talk, to see, to speak. You definitely want to call 911. If someone is experiencing intense chest pain or left arm pain, it likely means that they're having a heart attack, and you definitely want to call 911. A lot of times it'll be difficult for them to breathe. They might have some irregular or fast-paced heart rate. And if someone is losing a lot of blood, so if someone accidentally cuts themselves really badly, or if they fall down and really injure themselves, you want to dial 911 because blood loss can cause you to go into shock, and we want to get that addressed before you reach that stage. So urgent care is for when we are feeling unwell but can wait to be seen by a doctor. So in urgent care, you're going to sit in a waiting room until a doctor is ready to see you. Typically, you're going to go to urgent care for sprained muscles, for broken limbs sometimes. If you have a minor cold or a minor case of the flu where you have a fever but you're still conscious and you don't feel overall sick. Emergency care, however, is when we need immediate medical attention and cannot wait to be seen by a doctor. So emergency care is basically all those situations Ms. Morris just discussed. If you become unconscious, if you have a fever of 100 degrees, like a 103 degrees or higher, you want to go to emergency care because at that point, your body is having difficulty regulating your temperature. You need to figure out if you have a bacterial or viral or some other infection. If you're having a heart attack, so chest pain, left arm pain, And of course, if you're losing a lot of blood, you want to go dial 911. An ambulance will take you to an emergency room. Okay, so this is an emergency room opening right here. However, in both scenarios, it is super important to remain calm and know that a team of doctors, nurses, and other healthcare professionals are going to take excellent care of you and your loved ones. So it can be scary when you encounter an urgent or emergency situation, but just remain as calm as you can and follow the steps. So tell your mom and dad that you are feeling sick, dial 911 if necessary, and follow through with what the doctors tell you to do. So if they tell you to take some medications and go home, you're going to take those medications exactly how they tell you and go home. If they keep you for observation, you're going to stay at the hospital, but you will be surrounded by medical professionals who know exactly what to do and how to take care of you. So there's no reason to be afraid. We're going to talk more about health routines in our lesson today. So I will see you guys then, and take care.